When people in movies and television time travel, they never really mention the stank.
Oh, that smell is
historically accurate.
Oral hygiene hasn't always been the most important thing in human history. Over thousands of years, humanity's searched to unravel the mysteries behind dental pain, tooth decay, tooth loss.
I'm saving my teeth so I can put them back in.
But we've not only figured out what causes these issues, we've actually discovered how to effectively treat them, along with preventative dentistry. You know, the thing that, prevents your teeth from falling out, like brushing and flossing. Yeah, I said flossing.
Floss? No one does that.
Regular professional cleanings, exams, you guys get the point. But today, we're going to take a journey back in time to uncover the astonishing and often really bizarre ways that our ancestors took care of their teeth. Our story begins in the age of cavemen, where oral hygiene was, well, a bit prehistoric to say the least. Imagine you're living in a cave, and your tooth starts acting up. What's your go-to solution? Chewing on sticks. Yep. Might sound odd, but these primitive toothbrushes actually did the trick. Just like this one here. These early dentists pioneered chewing twigs to remove food particles. You chew on this little scraped side and it turns fibrous. Fast forward a bit and we find ourselves in the land of pharaohs and pyramids. And the Egyptians had a lot of their own unique dental customs. They believed that toothaches were actually caused by tiny little worms, and they weren't about to let them critters get rampant. So what'd they do? Well, they concocted an early form of toothpaste using ingredients like pumice, myrrh, and crushed eggshells, just like Mama's crunchy omelets.
I'm saluting my eggshells.
They'd apply the mixture with chewed up twigs and effectively combat toothaches and bad breath. Around the world, ancient civilizations were making large strides in dental hygiene, and their resourcefulness in maintaining the oral health is really nothing short of astounding. Now we're taking it to a time where dental care was a little medieval.
There was a beauty to medieval torture.
And that's where dentists got a bad reputation. Often referred to as barber surgeons, they'd whip out their trusty extraction tools, which looked more like torture kits than dental instruments. They still sell torture kits. Like, I'm thinking of a guy going, yeah man, let me take one of them Torment Pro 5000s. All right, well, if you thought that dental visits were tough, imagine dealing with pliers, hammers, even fingernails.
Fingernails?
Dentistry and barbers, they were one thing back in the day.
And I'm here for my annual haircut and bloodletting.
I don't know, maybe it was because the chair would lean back for both. So, side note, around this time is when Europeans were invading what we now call America, and they often referred to the indigenous people as savages.
savages.
Not that you're a savage.
But the natives were the ones with the understanding of hygiene, actually, and bathing, cleaning their teeth regularly, things of that nature was common for them. While pilgrims, they never bathed, and they smelled atrocious according to the natives.
Smelly smell that smells. Smelly. Anchovies.
Not only was the smell bad, but the filth also brought microbes causing disease, mass extinction to the people who had never had these kind of issues before, or these harmful germs.
These white men are dangerous.
Now, let's exit the dark, smelly ages to a time of enlightenment, art, and yes, more advancements in dentistry. The Renaissance. During the Renaissance, dental care took a leap forward. Enter Ambroise Paré, a French barber surgeon, who had many advancements in medicine, surgery, and, dentistry, often referred to as a gentle surgeon of his time. Due to the lack of his gunpowder in the surgery room, he introduced more humane tooth extraction techniques, and he paved the way for modern dental practices like ours. The 17th century was a pivotal period in the history of dentistry, where we witnessed the emergence of remarkable advancements and some intriguing dental practices. Some say Ambroise Paré walked so Pierre Fauchard could run. Fauchard published a groundbreaking book in the 1723s titled Le Chirurgien Dentiste, the Surgeon Dentist. In this literary masterpiece, he detailed dental anatomy, oral surgery techniques, and the use of dental prosthetics. People still carried the belief, in fact, that worms cause decay.
Bugs?
Yes, bugs.
Is that what that is?
But thankfully, French fry guy Fauchard, he introduced the idea that acids from sugars were the primary cause of tooth decay.
Okay, that's enough sugar for you.
Thankfully, this era also witnessed the introduction of toothbrushes, but they were made from bristles of horsehair and boar hair, but still, better than sticks. The 17th century was a period of transition and discovery, paving the way for modern dentistry. Merci, Mr. Fauchard.
Au revoir.
The 18th century is where dentistry as a profession really moves away from the barbershop, starts to take shape in its own way.
Well, I'm doing my own thing.
Dentists began to specialize and dental schools began to emerge. One notable institution, the Royal College of Surgeons in London, even offered a diploma in dental surgery in 1799. Dental instruments also underwent a pretty big transformation. While some tools remained primitive, others showed marked improvement. The 18th century saw development of more specialized dental instruments, such as forceps for tooth extraction and files for cleaning teeth and shaping teeth. Dental hygiene was starting to become much more common knowledge.
Brush your dentist twice a day, visit your toothbrush once a year.
But here's an intriguing twist. People of the 18th century were known for their sweet tooth, and sugar consumption skyrocketed. As a result, tooth decay became increasingly prevalent. So dentists of the time had their hands full dealing with cavities, toothaches, and all those things caused by sugar consumption and following decay. The need for false teeth to replace all the ones that were falling out were at an all-time high. And I'm here to debunk a big myth, by the way. George Washington's, his teeth were never made of wood.
You had wooden teeth.
No!
Everybody thinks they're made of wood. I saw them at the Smithsonian. They're still there. They're made of ivory. A lot of dentures at this time were made from ivory and other human teeth. Peasants would also sell their healthy teeth, or teeth would be taken from the mouths of enslaved people. That's terrible. Well, one of the most significant developments of the 19th century was the advent of anesthesia. In 1844, a dentist named Horace Wells attended a public demonstration where nitrous oxide, which is commonly known as laughing gas, was used for a painless extraction of a tooth. It was a game changer.
Woohoo!
The 19th century witnessed establishment of dental schools and societies, such as the College of Dental Surgery in Baltimore, founded in 1840. These institutions played a vital role in advancing dentistry and the knowledge and standards and practices. But as always, there were some quirky dental practices still lurking about, like dental vampires.
You're a dentist. Can I show you?
I've never seen anything like that in my...
Yeah, some people believe that tooth extraction can actually cure various ailments. So that led to a rather bizarre practice of just extracting teeth unnecessarily.
It was a huge success, but I had to remove all of your teeth.
But all this time and education led to dentists being seen more as mere tooth pullers, thank God. They were skilled professionals, dedicated to improving oral health. Our historical journey has led us now to the 20th century, the one we just got out of, an era brimming with groundbreaking discoveries, innovative technologies, and notable pioneers. So let's kick things off with a remarkable milestone. The 20th century finally marked the rise of women in dentistry.
What took you so long?
One notable trailblazer being Lucy Hobbs Taylor. She in 1866 became the first woman to earn a dental degree in the United States. In fact, now nearly half of all dental students are women, which I bet would make Dr. Taylor pretty proud. Now on to technological marvels of the 20th century. This century saw the introduction of x-rays in dentistry, revolutionizing diagnosis and treatment. There was no more guessing games for me or other dentists, because now we could see what's happening beneath the surface of them pearly whites. The century really figured out prevention dentistry with advancements in x-rays and fluoride, but it was also the era of cosmetic dentistry. People began seeking not only healthy teeth, but they really wanted those Hollywood-worthy smiles. So the development of veneers, teeth whitening treatments, all those kind of things, braces, the common stuff nowadays, so people could achieve dazzling smiles that they'd always dreamed of.
If that was really a mirror, you see a perfect smile.
Now let's talk about the evolving role of dentists. Dentists became not only oral health experts, but also advocates for overall well-being.
You owe your life to dental hygiene.
They played a crucial part in educating the public about the importance of oral hygiene and how it relates to their systematic health issues. As we move towards the end of the 20th century, dental research continues to expand our understanding of oral health and its connections to the rest of our body.
I flossed to save lives.
It was an exciting time for the profession, with constant advancements in improving patient care. Remember when I said going to the dentist can be enjoyable?
Yeah.
Awesome, because that wasn't always true, until now.
I don't know why I trust you, but I do.
You just learned how dentistry has been consistently evolving into prevention dentistry and patient-centered care. So to recap, prevention dentistry are the things that we do to keep our teeth and gums healthy. It's basically fighting decay and fighting that battle.
That's because tooth decay sucks.
Brushing twice a day in the morning, before bed, flossing every day, using mouth rinse, and having regular dental visits and cleanings with doctors and practices like this. But we also know that decay happens. And modern dentists are focused really on making sure not only are you comfortable, but that you understand everything you need to know.
Get it?
got here?
Good.
A comfortable office, friendly staff, truly listening to patients and educating them on treatment. Those are just a couple of ways that dentists now take to focus on the patient. Sometimes people need a little more help with that white coat syndrome, which is why dentistry now offers nitrous oxide, which is laughing gas, anxiety medications, and IV sedation in many offices around. We're also able to do treatments with little to no pain because of the accessibility of local anesthetic. Pain medication before and after appointments, better practices and precision, all great things. Talk about modern dentistry.
I don't think his drugs are working, you guys. When am I teeth gonna get surgical?
It's already over.
Hey guys, thanks for watching. If you made it this far, you must have thought watching this video was better than watching cats. So pull that subscription lever and stay tuned for more.
Pull the lever, Crunk.
And we're gonna see you guys next time on Truth Be Told. I'll see you next time on Truth Be Told.